The scapula is commonly called the shoulder blade. This video reviews the anatomical landmarks of this bone along with some common injuries. The scapula is a relatively flat triangular shaped bone that is on the posterior or dorsal side of the body. Every human has two scapulae, one on each side of the body. They are important components of the shoulder girdle. The scapula contains many structures that function as sites of muscle and joint attachments.
Because of the bone's triangular shape, there are three borders. There is the medial, lateral, and superior border. The medial border is towards the midline of the body, closer to the vertebrae. The rhombitis major and minor intersect on the medial border. The muscle allows the scapula to retract and rotate. The muscle also stabilizes the scapula. The lateral border is on the lateral side. The teres minor originates at the lateral border of the scapula. The lateral border is also the origin of triceps brachii. The superior border runs along the top of the scapula. These borders are easily remembered because all of their locations are indicated in their names. The scapula also has two angles. The superior angle is located at the point where the superior and medial borders come together. The inferior angle is located at the inferior end of the scapula, where the lateral and medial borders meet. The origin of teres major is located at the inferior angle of the scapula. The ridge of bone on the posterior view is the spine of the scapula. This can be felt underneath the skin on the back. With this view of the scapula, two fossae can be seen. The spine separates the supraspinosus and the infraspinosus fossa. The supraspinosus fossa is located above the spine by the superior border of the scapula. The supraspinatus muscle originates in the supraspinosus fossa. The infraspinosus fossa is located below the spine. This is the origin of the infraspinatus muscle. These structures are easily remembered because they have the Latin root spine, so the structures are located on the side of the scapula that includes the spine. The acromion process is located at the end of the spine on the lateral side of the scapula. The acromion process articulates with the acromial end of the clavicle. The acromion process is the origin of the deltoid and the insertion of the trapezius muscle. Inferior to the acromion is the glenoid fossa. The glenoid fossa articulates with the humerus. For the ball and socket joint of the shoulder, the infraglenoid tubercle is located directly below the glenoid cavity. As its name indicates, the supraglenoid tubercle is located directly above the glenoid fossa. The origin of biceps brachii muscle is at the supraglenoid tubercle. The lateral view also shows the coracoid process. This hook-like structure articulates with the clavicle and the humerus. The coracoid process is also the point of origin for the biceps brachii and the insertion for the pectoralis minor. A way to know the difference between the coracoid process and the acromion process is that A is before C, so A for acromion process is above the coracoid process. When turning the scapula over to an anterior view, the depression indicates a fossa. This is the subscapular fossa. This fossa is remembered because of the root sub, which means under. So the subscapular fossa is on the anterior surface of the scapula. The origin of the subscapularis muscle is at the subscapular fossa. Also on the anterior view of the scapula is the subscapular notch. The notch is on the superior border by the coracoid process. The suprascapular notch is a pathway for the suprascapular nerve. A dislocated shoulder is a common injury involving the scapula. This occurs when the humerus gets forced out of the glenoid cavity. This injury is common in contact sports such as football. Falling or a forceful impact, like a car accident, can also cause a dislocated shoulder. The anatomy of the shoulder makes it one of the body's most mobile joints, making it prone to dislocations. A dislocation is treated by a closed reduction, which is when the doctor manipulates the shoulder bones back in their proper positions. This procedure relieves severe pain almost immediately. Surgery is sometimes needed if the shoulder joints or ligaments are weak. Also, splints can be worn to immobilize the shoulder. Rehabilitation and physical therapy are utilized to regain strength, stability, and the range of motion of the shoulder joint. The scapula, like all bones, are important parts of human anatomy. The scapula is essential for the movements of the upper appendages as well as protection of the lungs and heart on the dorsal side of the body.